inviting her in this conference, and the audience have been really blessed. So today you're going to really be blessed by Dr. Taylor. So we are talking about keys to kingdom living, kingdom health and wholeness. So we are talking about key number 6. What is the role of medication therapy? As I've been talking about trusting the Lord. So what is the role of medication therapy?
Well, you did refer to it in your teaching, which I was blessed by, so thank you very much. But medication helps us when that homeostasis has been broken. The body, regulates itself through feedback loops. It says, hey, we're a little low in our cells in this component. Can you keep up the production a little bit more? Your kidneys, your adrenal glands, they kick in the production and raise the levels of the things that we need. When we don't need, when we have an excess of things in our body and our cells, it'll say, hey, that's enough now, and the production will shut down. So that's how your body regularly regulates itself. But in disease state, that's broken. The feedback loop is not working the way it should. Sometimes you'll get overproduction and it doesn't stop. Or you need something and the production won't start. So the role of medication is now to come in and prop up the proper levels of things that we need during that disease state. Kind of like a chair. I don't know, in my house, we weren't rich people, so if a chair broke, sometimes my dad would come and put some bricks under there, right? Okay, the chair is upright, but now those bricks cause some other problems. We're walking around stubbing our bare feet on the bricks. It's not supposed to be there forever.
Yes.
Just enough to keep the chair upright until you can go get a leg, carve a leg, build it again. It's something temporary to help our body in that disease state.
Ooh, I like what you said. Medication therapy is a temporary treatment. Before, I want to talk more about that temporary usage of medication. Are you hearing this? I hope some of my patients are watching because I keep telling them these things. And some of them just say, well, you're a minister, and this is scientific truth. Before I get to that temporary usage of medication, I want you to answer a question that really is a yes or a no, and then you can elaborate on this. Are medications curative? It's a yes. Do they cure diseases? Yes or no?
I think many people know the answer here is no.
No.
Right?
Did you hear that? Medications are not curative. They don't cure you, and I did mention that in my teaching. So talk more about that. Which categories of drugs are curative, meaning that they cure, and which ones are not?
Right. So if you look up the term pharmacological cure, right? I Googled it today to check, to say, oh, and maybe I'm out of date. Let me check. And there are 0 hits for all the search engines I used. Pharmacological cure, no hits. We talk about treatment and what the course of treatment is. And usually...
Pause.
Yes.
What she said is so profound. I want you to listen to this. She said she did her research, and on the
pharmacological cure.
That's a big term. What does it mean to the layperson?
So a medications
cure,
right?
It doesn't cure you. Yeah. So hopefully you're beginning to understand that depending on drugs is really harmful to you long term. So sorry to interrupt you. I just wanted them to allow that to sink in. So continue.
Yes, so if there were pharmacological cures, right, all of those companies that are propping up the stock market, they might lose out on some of their revenue over time. But when we think of things that might be curative, sometimes we think of when our body has an infection, when it's playing host to something that should not be there, or something that's there in too much amount. For instance, bacteria, viruses, fungi, all right? Like the fungi that might be growing in your house can take you over sometime too, right? And parasites, just like we're an animal, some animals get parasites sometimes, we are susceptible to them too. So then the medication, the anti-infective medication, the antiviral, the bacterial medication will come in and remove that organism that has overgrown in your body as the host. So that can take that away.
So, if I understand you correctly, don't be discouraged, you watching there. What Dr. Tello is saying, and it's backed up by science, is that, and I talked about this briefly in my talk, antibiotics will cure, antibacterial, antiviral, otherwise medications will not cure you. So let's talk about how the role of medications in chronic disease state and the categories of drugs that are considered or that are used a lot today. Because in my own practice, and for those of you who don't know, my practice is considered integrative medicine. I prescribe drugs, and even though my focus is on holistic lifestyle, but unfortunately sometimes patients come to see me and they just want drugs, and I have to go through all this teaching with them and help them to see that lifestyle remedies really are the best. And I tell them that to be dependent on drugs long term, it doesn't really help you, which is why, like in my case, 95% of my patients have diabetes, high blood pressure, high cholesterol, heart disease, and we start with one drug, high blood pressure. It's not controlled, second, third drug. The average patient with high blood pressure uncontrolled needs 4 to 5 drugs. So why don't you talk to the audience about these chronic diseases that people need multiple drugs, and is this really working? At what point do we say, okay, what else do we need to do here?
Okay, so just to address what you said, chronic diseases, when we're talking about that, we're talking about things, for instance, like the CDC here in America, the United States Centers for Disease Control, has defined chronic diseases as where ongoing treatment is needed for 1 year or more. And they have actually categorized which diseases are the chronic diseases for us, such as diabetes, hypertension, and cardiovascular disease, which is really has arteriosclerosis at the heart of it, where your blood vessels are not working in the way that they should, and they become blocked. And it recognizes that the root cause of these diseases is risky behaviors in our life. And they have categories, some risky behaviors such as tobacco smoke, poor diet, lack of physical activity, and excessive alcohol, among others. So while we are there are medications for these diseases, no doubt, but we know that there are behaviors to address as well.
So
Those
now,
are the root cause.
So let me ask, what about things such as depression and anxiety? I know we talked about this last year. So what is the CDC saying about those? Because this is a very common thing in the US. A lot of patients want antidepressant, anti-anxiety. What are they saying about this?
Actually, yes. It's, the CDC is really concerned about anxiety and depression in these days, in these post-COVID era that we're living in. We know we've had an increase of anxiety, depression. Mental health wellness is a key focus for us in these times. And medications for anxiety, depression, mental health well-being are some of the most prescribed medications here in the United States. But as we discussed last year, there are other treatment modalities that are just as good as medical medication, and that the medication on its own has not shown an advantage of other treatments on its own. So if you're going to choose to do counseling, the medication is not going to outweigh counseling. If you choose to do electrotherapy, one is not better than the other. So usually they're used in combination for the best advantage to address mental health.
And like we discussed last year, I know we keep referring to last year because we had this whole thing. We can go listen to that. Let's just touch basis on this. Depression, anxiety, these drugs don't cure you.
Right.
These drugs don't address your thought, your thinking patterns. It's only through counseling, right? So we need to understand that anxiety, depression, as I discussed, especially with fear, these are, for a Christian, issues of crisis in faith. And the cure is focusing on God, depending on God, and gaining insight as to why you are depressed, gaining insight as to why you are anxious. And there is no condemnation. It's really just call upon God to help you, spend more time in God's presence, have a deeper revelation how much God loves you, because God truly does. God truly cares. So we cannot be too worried. And again, I have several teachings on that. What would the worrying do? It only takes you to an earlier grave. So medications would only knock off the symptom, help you to be relaxed for a few hours, and you're going to go back to the same worrying. So if you're learning anything from this talk right now, medications for chronic diseases are not curative. So you have to really start considering some of the things I discussed in the first session, how to really overcome and live daily, those keys to kingdom living daily, and really just enjoy good health and longevity. So being that many people are dependent, and I use that word regrettably, and as a clinician, I see this a lot in my practice. Many patients are dependent on drugs. I'm not talking about cocaine. I'm talking about prescription drugs. I'm talking about drugs for diabetes, cholesterol. They don't want to do lifestyle remedies. And as a preventive lifestyle doctor, that is the most difficult treatment modality there is. People think it's easy to just take a pill than to lose weight, than to exercise, than to go to God. But what they fail to understand is that the more pills you take, the more you damage your body's ability to fight off diseases, and you're not even giving your body a chance. So why don't you talk about this long-term chronic use of these drugs for chronic diseases, side effects, and things like that, and the different categories of drugs we see a lot?
Okay, so diabetes is a big one. So often that's in combination with hypertension and cardiovascular disease, or you can have those others standing alone. But some of the first line medications that you'll see for diabetes are ones that control blood sugar, either by mimicking the actions of our own insulin in our body, which is a hormone that helps us use sugar in the right way, or by supporting our body in producing more insulin. So it's going to mimic our own health process. Okay, so when you see that, I don't know if I should, well, I'll discuss that. When you do that and you're not addressing other things, the role of insulin is to help the body sometimes store the glucose, store the carbohydrates, store the energy. How is energy in a human being stored? Do you know? It's stored in our love handles, okay? So that's how our body stores the energy. And when you start those medications, what you'll see is some weight gain.
Yes.
That's how they're supposed to work.
Yes.
And I wanted to mention that because there was the ADA, the American Diabetes Association, has made a change recently this year. So usually you would see the pills, metformin, glipizide, as some of the first line of therapy. But now the American Diabetes Association is saying, well, we can try some of the newer injectable medications that don't promote weight gain so much, because that has been an issue with some of the other first-line medications. Now, I want to mention as a caveat, when I talk about newer medications, we have to keep in mind there is a rigorous process here in the United States and most of the world to make sure your medication is going to be safe and effective and do the things that the company says it's going to do. We have the pre-market research, and that's been in the news a lot, the clinical trials before it ever gets to the shelf for you to get. But we also have something that's not as fancy, not as glamorous, not as mentioned as much, which is called post-market research. And that's research to see how the drug will work over the long haul. How is it going to do 10 years, 20 years, 30 years down the line in a population that's using it? So while we do have that information with some of the older drugs, keep in mind when we have a newer drug, we don't have that post-market research available to us yet. But I am going to mention that the GLP-1 inhibitors, those are the drugs that mimic incretin in our body that help us get the sugar out of our body, that help us excrete it. And the SLGT2 receptor agonists, those are like your Byetta, Bydureon.
And you hear this on television all the time, yeah.
Yeah, Farxiga. These drugs are the ones that are newer. So they have shown some advantage. So that's the first line. Things that mimic insulin or mimic other hormones in our body that help us take the sugar out of our bloodstream where it's damaging.
You know, this is interesting. Did you hear what she's saying? Things that mimic. Mimic the body. So there are other things that are lifestyle related that you can do that will also mimic the body, like exercise. Exercise will also allow the body to produce.
That's the real thing.
That's the real thing. Will produce natural hormones. Weight loss, if you lose extra pounds, if you eat correctly, that will allow the body to really heal itself, to release these hormones, because all these drugs are doing, they're trying to do things that you are supposed to be doing through exercise. But these drugs, they are short term. And they don't cure you. They're helping you a little bit. And very soon you deal with all the side effects. Unlike these other lifestyle things, there are no side effects. So why, okay, go ahead. And I have a question I want to ask, because it's so important how integrate, and here is the key. And really, I have nothing against medications. Let me just, this is a disclaimer. I prescribe drugs. I'm a prescriber, authorized prescriber, licensed prescriber. I prescribe drugs, I prescribe narcotics. There is a time and a place for drugs. There are patients that I have seen that I'm like, and they are so gung-ho, they want to come to me for lifestyle remedies, and I look at them and said, you know what, we're going to start some drugs now, and then we're going to start lifestyle remedies as well. And then in time, we're going to slow down on the drugs so you can get into the habit of these lifestyle remedies. So there's a time and a place for drugs. So I want for you to address that place. So don't feel like I am saying that you don't need drugs, because then I would be a hypocrite because I prescribe them.
Right. So when you come to see Dr. Ruth and you have a high cardiovascular risk, that means that it's likely that you could suffer from stroke, from heart attack, from things that ultimately will debilitate you or put you at a higher risk for death. Remember, we want to live a long life.
Yes.
And actually, medications can help with that, right? If you are experiencing those high-risk things that say, hey, wait a second, you know, we don't want death to be at the doorway for you, let's start the medication.
Yes.
They can decrease that risk.
Yes.
So another thing that's helpful with that is drugs for cardiovascular risk. The cholesterol, which is a component that can increase the arteriosclerosis in our blood vessels, harden them, increase the blood pressure, increase the work for the heart. So it's wearing itself out. So drugs that address cholesterol, a popular class is a statin drug. So you might have heard of atorvastatin, that's Lipitor, rosuvastatin, that's Crestor, and there's lots of other statins. Those drugs interrupt our body, our liver, from making more cholesterol. So our body has a process to make cholesterol. That's what our hormones are built out of. That's why when you're a young man, you might find the girl of your dreams, okay? Because our body is using that building block of cholesterol to make hormones. But then it can be in excess. That regulation, that feedback loop has not worked properly, and we're producing too much. So the statins will go in and cut off that building chain to build more cholesterol in the body.
And I wanted to add too, like what she's saying, very important, and I tell this to my patients all the time, except if you have like a dying cardiovascular risk, like she is saying, or you've just had a recent stroke or recent heart attack, if you just really have high cholesterol because of obesity, excessive caloric intake, you can work on that. You don't need to go on drugs right away. And I tell my patients that your cholesterol is slightly elevated. You are not at risk. I did a calculation for the cardiovascular risk. I said, you are not at risk to have a cardiovascular event in the next 10 years. Listen, how about if we work on your lifestyle, your diet for the next 3 months, and that is actually the recommendation, and then we recheck it, because like she was saying, the body makes cholesterol naturally. You don't have to eat cholesterol from the outside. What happens with high cholesterol is that you eat too much excess saturated fat, and then you overwhelm the body's ability. Now you're having extra cholesterol coming externally. The body is trying to produce it internally, and then you have this high cholesterol clogging the arteries. So I've had patients that have put on a basic vegetarian diet for like 3 months, aggressively, and their cholesterol came back perfectly nice, and they never went on a drug, and they start to exercise. So there are things you can do to really stop heart disease, to stop cholesterol clogging your arteries. You don't have to wait until you get to the stage where you're having a heart attack. I just wanted to say that.
Right, exactly. So that's one of the medications. Now, over time, these medications are not without risk. They do work in the liver, so they can cause other things in your liver to be produced in excess too, and that's a poison to your muscle fiber. So we have, and what is our heart made out of? Muscle. So that's one thing that you have to keep an eye out for.